you so much for joining us today for NAMI's Wisconsin's Growing Stronger Together virtual event. I'm Mary Kay Battaglia. I'm the Executive Director for NAMI Wisconsin. We are so glad you joined us, and this will be our last session for today. I'd like to take a brief moment to thank my staff, our staff, and in particular our Communication Events Coordinator, Ellie Thompson, who has put together this virtual event. We've planned two in-person conferences and had to cancel them, and we've redone this, and just the staff has been amazing. Stacy and Molly are doing a lot. Helen and Megan stepped up and helped us. So, and Gina's just taking phone calls. So thank you so much to all of the staff today. It's been great. Before we get started for our next presentation, let's have a quick icebreaker poll. Here's the questions. Would you rather be able to speak every language in the world or speak to animals? And let's see who the winner is. No way. It's totally a tie. I even had in my notes here to say, okay, Dr. Doolittle's let's get started, or linguist, but I can't. It's both. That's amazing. So, okay, that was fun and interesting. Let's get started. At the end of this presentation, we will have 15 minutes question and answer session. You can ask questions in the Q&A box on your Zoom bar, and we encourage you to ask lots of questions so that we can have an engaging conversation at the end. It is now my honor to introduce Dr. Heather Schmidtknecht and her talk, Supporting and Enhancing the Role of Family in Mental Illness Recovery, What Providers, Consumers, and Family Members Need to Know. Dr. Heather Schmidtknecht has been a registered nurse for 25 years. She earned an advanced practice nursing degree as a family nurse practitioner in 2011. Her early experiences as a nurse practitioner fueled her passion to care for and advocate for people with mental health needs. In May of 2018, she earned her doctorate of nursing. Her translational project was addressing mental illness stigma. She is currently an associate professor at Winona State University in Winona, Minnesota, where she teaches undergraduate nursing students in the classroom and the clinical setting about caring for patients with mental health needs. She also is currently serving on the board of directors at NAMI La Crosse. Dr. Schmidtknecht, thank you so much for joining us today.
Thank you for inviting me. Okay, so hopefully everybody can see the first slide there. Today, I'm excited to be here to talk to you about supporting and enhancing the roles of family in mental illness recovery. Next slide, please. So in this presentation, we'll discuss, next bullet, please. The importance of family in mental illness recovery. Next bullet, please. And to be able to do that, we need to talk about what are the tasks of mental illness recovery. Next bullet. And what are the facilitators and the barriers to recovery. And then finally, we're going to add with kind of summarizing it all up in ways that providers, consumers, and family members can work together. Next slide, please. So the first thing I think that, some people would ask is, who's considered to be family? So the answer to that is it could really be anybody. It's that definition is going to be very individualized to the consumer. So it's going to be whoever the consumer determines to be their family. And they don't have to be blood relatives. They don't even need to live with them. It can just be whoever they feel closest to or most supported by or who they trust. Next slide, please. So we've mentioned the terms mental illness recovery. So I think it's important that we talk about what does that actually mean? So recovering from mental illness is not just the symptoms going away. There's lots of things that happen when people are struggling with mental illness. Sometimes there's a quite acute phase where they're having lots of symptoms, they haven't been able to work, they're not really connecting with people that they used to connect with. Maybe they've been hospitalized for a long time, or a lot of their time has been in treatment or therapy, those kind of things. And so it's important that we not look at mental illness recovery as just the ceasing of symptoms or the reduction of symptoms, but that we're really looking at the whole person, and not just physically and not just psychologically, but looking at social aspects of their life, and maybe academic or occupational aspects of their life, or spiritual. It's important that we're looking at the whole person. It's also important that we're allowing this person not to be defined by their mental illness, but learning to sort of live the best life with mental illness. So sometimes when we talk about mental illness recovery, there's certain frameworks or models that kind of help define that. So the model that I'm going to talk about today is called the Chime recovery model. Next slide, please. So the tasks of mental illness recovery, according to the Chime model, are as follows. So, yep, there you go. Connectedness is the first one. And when we talk about connectedness, we're really talking about, are they connected to their community? Do they have meaningful relationships in their life? Do they have good peer support? And by peers, we mean people that also suffer from mental illness. And then, are they meaningfully connecting with social groups? Okay, next bullet, please. The next letter in Chime is H, and that's for hope and optimism about the future. So here, it's really what it sounds like. We're just really wanting them to be able to focus on the future and not be stuck in, this is what's happened to me, but this is where I go from here. So it's belief that recovery is possible. It's positive thinking about, day-to-day life and what's in their future. And it's having dreams and aspirations for the future. Next bullet, please. The next letter in Chime is I. So that stands for identity in this framework. So we're actually hoping that this person can rebuild a positive self-concept, a positive sense of identity, overcoming stigma that mental illness brings into their life, and really, again, not being defined by this illness, but finding out who they are with mental illness. Next bullet, please. M stands for the meaning in life. So we want them to have a meaningful life. We want them to engage in meaningful social roles and to set some social goals. The other thing that's important, and sometimes the research will say that people kind of reach a higher level of recovery if they can find some meaning to their mental illness. So just to offer a brief example of that, I have a friend that suffers from bipolar disorder, and he really feels like his mental illness, that happening to him, was the best thing that ever happened to him. Does he struggle with mental illness? Yes. Does he need to take medicine, the rest of his life? Yes. But he feels like it has totally refocused his life into what is important and maybe what isn't as important. And so he really has embraced his recovery and decided that this mental illness is not going to define him, but he's going to take it along with him to define who he is today. And then the next bullet, please. The next letter and the last letter is E for empowerment. So it's important for people that have struggled with mental illness, especially when they're kind of transitioning from acute illness, where they were very dependent on others, to be empowered, and empowered to have personal responsibility and to have control over their life and to have independence and autonomy. And it's important for them to really be able to focus on what are their strengths. Next slide, please. So family can be a facilitator of recovery via these things. So the first one is social support. So being connected. So that might mean spending time with that person, It might mean including them in family functions. It might even mean simply getting them out of the house. Next bullet, please. Moral support is really important. So family or people that are close to you that you might define as your family really have a way of knowing how to support you best. And they knew you before you had your mental illness. And so it's important that they remind you of who you were and what your aspirations were, and that those things can still happen. This mental illness, again, does not define you. The other way that family can really help with the moral support is helping you to reconnect with people that you are no longer connected with for whatever reason. Maybe it's just simply, you went your separate ways, or just because you were, busy with treatment or whatever, you're out of contact. But sometimes consumers have hurt people during the acute phases of their illness. And sometimes then those relationships are, broken. And so sometimes family can be very instrumental in helping people rebuild those relationships and make amends. Next bullet, please. The next bullet is practical support. So this could be financial support, this could be transportation to appointments, and it could also be assistance with bill paying, completing forms that need to be done, or even household chores. Last bullet, please. And then lastly, treatment plan support. So that might be going along to the provider appointments to be a second set of eyes or ears, reminding people to take medications, reminding them that they have follow-up appointments, insisting that they stay clean from alcohol and drugs, because that is likely an important part of their recovery. And then just wanted to mention also that the research really shows that when family is supporting recovery from mental illness, quality of interactions is really what matters. So it isn't that you have to be there all the time or every day, but it's the quality of the support that makes it meaningful. Next slide, please. So family can be a barrier to recovery also. And so it's important that we talk about those things, because I think most people are helping for the right reason or trying to, right? So it's important that we make sure that we think about and talk about what's not helpful, all right? So the first one is stigma and lack of understanding. So this might be the family member's refusal to acknowledge or understand the mental illness. There's a lot of lack of education out there, or even miseducation, misunderstandings. And so I think it's important that we're watching for this. And then we also don't want families to convey that, we don't want to tell anybody about this. We don't want to treat it like a secret. Sometimes that stigma can kind of inadvertently make people kind of do those kinds of things. But of course, that's going to be a barrier to the person's recovery. Okay, next bullet, please. So judgmental, condescending, or coercive family members, right? Those kind of people are barriers to any relationships, right? But in this particular scenario, what the research really shows is these kind of behaviors and attitudes from family members really causes self-doubt in consumers. And so it's really important that we kind of watch for those kind of things as well. Next bullet, please. And then high emotional expression, or sometimes you'll see it abbreviated EE in the articles. And so what this is maybe family members that are a little bit more volatile, or families that are a little bit kind of don't have the filter that they might need all the time. So things that might be common are like criticism or hostility, or even over involvement. So they're kind of just taking over. Next bullet, please. So And then the last bullet I think is really interesting, and I think this is probably really common also, is when people are acutely ill, they do need more help and they are more dependent on others. But when they start to get better and they start to get out of that acute stage of illness, sometimes it's hard for family members or support people to kind of transfer that control back to the person. So failure to transfer that control back after that acute illness stage can be a barrier to recovery. Next slide, please. So the big question then is, how do we work together? So knowing this, knowing what the tasks of mental illness recovery are, knowing what the ways are that families can facilitate recovery, and knowing how they can be barriers to recovery, how do we work together? Next slide, please. So we're going to start with the providers. So there you go. The first thing I feel, and you know, as a provider, I think this is really important, is to educate consumers on the actual and or potential roles of family in recovery. So it's important that consumers know that, you know, it might be possible to do this on your own, but, you know, support is really important, and family can be, you know, have some pretty meaningful roles in your recovery if you'll allow that, okay? Because it's going to be the consumer's choice. But I think sometimes they don't know it's an option to include family, and sometimes they are under the understanding, you know, that maybe it makes them weaker if they need other people to be there. And so I think just knowing what the potential roles of family members are, and, you know, that the literature really does support family involvement, I think that's important to let the consumers know that. Next bullet, please. So it's important as a provider, I think, to encourage family involvement in all parts of the treatment plan. So there are going to be some cases where family is all in and the consumer is fine with them being all in, but there might be times where you pick and choose what parts family wants to be involved in, or what parts the consumer would like the family involved in, and not others. So it doesn't have to be an all or nothing thing. It can be whatever seems like it makes the most sense at that time. So next bullet, please. A couple of important reminders when it comes to encouraging family involvement is, at the very least, we need family psychoeducation. This is huge, huge, huge. If families don't understand what the illness is, or they don't understand, you know, what potential complications might be coming, those kind of things, it's hard for them to be involved in a positive way. They need to know, like, you know, how does this diagnosis present itself? What's the common treatment? And how does that match up with what we have, you know, for our family member? And I think unfairly in our system, we place a lot of responsibilities on families to pick up the pieces when things go wrong, but we don't equip them very well to do that, or to help, you know, as things are getting better. So I think we need to give more families more tools to put in their tool belt to be supportive. Next bullet, please. And then some of you are probably thinking, what is she thinking? What about HIPAA? Okay, well, yeah, HIPAA says that we can't talk to people about our patients' care unless they let us, right? So I think as a provider, it's super important to talk, again, if we go back to that first bullet, talk with consumers about how important it is to have people there to support you and involved in your treatment plan. And then ask, you know, could we sign the paperwork to have them involved? Again, it doesn't have to be all or nothing. It can be certain pieces and not certain other pieces. It also doesn't have to be forever. Most releases of information are time limited, but you can also pick your own time limit, and they can withdraw it at any time. So, you know, if they decide to let family in and then it's not going so well, they can withdraw that release of information. So I think it's really important. And I think for those of us who have worked with people that have mental illness, a lot of times when people are getting, excuse me, getting more ill and things are going the wrong direction, sometimes consumers can't notice that in themselves. And that's just the nature of the illness. But family really can, and the people that are around them. So I think it's important that, you know, family and consumers and providers are all kind of in the same communication loop. Okay, and then next bullet, please. And then assist everybody in establishing good boundaries and good lines of communication. This, I think, can be, you know, just a very simple conversation. It could be just establishing some sort of ground rules, that sort of thing. But if, you know, obviously there's going to be some families or some consumers, some, you know, relationships that are a little bit more dynamic and need a little bit more time and attention. And so if you as the provider, if you don't have time to work with this family on kind of how to support each other and how to communicate well, they could be referred to family therapy for something like that. And with the end goal in mind being that everybody can work together so that we can support as needed. And this might be extra important for those families with those high EE or high emotional expression members, because remember, they're expressing a lot of hostility and criticism and over-involvement. So it might be important for those members in particular to, you know, have some good boundaries and some good ground rules for that kind of communication style. Okay, next slide, please. So now we're going to talk about family. So what can family do? So first bullet is self-care first. You cannot support your consumer, your family member, if you don't take care of yourself. Okay, so it's like when you're on the plane, you have to put your own oxygen mask on first, and then you go to help others. Next bullet. So seek to understand the illness, the treatment plan, and the anticipated challenges. If you're not provided the information that you need to support your family member, ask. You know, you can look up all kinds of stuff on the internet these days. You know, that isn't always the best route of getting information because you don't always know what's a credible site, what's giving you good information. You also don't know if all of that even pertains to your family members. So I feel like the provider is a great resource, you know, and maybe they can give you certain websites to look at or certain written information to review, or, you know, or obviously they could do the teaching themselves as well. But I think it's important that you understand the illness and you understand the treatment plan and you understand sort of those anticipated challenges along the way, because that's really going to be important for you to be able to support your family member. Next bullet, please. Knowing that mental illness recovery, you know, one of the major tasks is for consumers to have that autonomy and feel like they're living their own life. It's important for family to ask for permission to participate or to help. Even if it's obvious to you that they need it, it's important that you ask for that permission. Next bullet, please. And then support as needed or as allowed, maybe I should have said, but aim to empower. Okay, so remember that, you know, it's kind of like that old saying, don't feed a man with fish, but teach him how to fish, right? So we want to empower them with positive feedback, or, you know, whatever ways that you might do that. But just to know that, again, you know, asking for that permission to help and then helping as needed, but always having the end goal in mind is that they're going to do this on their own, and that's part of a meaningful part of recovery. And then another bullet, please. So communicate your concerns respectively. For sure, there are going to be times when you have concerns about maybe how the consumer is handling themselves or choices that they've made. those kind of things. And so it's important to know how to communicate those concerns respectfully. And so sometimes I think you can, you know, depending on the family member and the consumer, I think sometimes you can actually talk about, so if I'm the family member or the mom, let's say, and I say, so if I'm concerned about some of your choices or some of your behavior, how would you like me to let you know about that? Okay. And maybe they will say, I don't want you to tell me that. Or maybe they'll say, I want you to say it, but I don't want you to yell at me, or I don't want you to, you know, point fingers or whatever. So I think it's important you can have that conversation ahead of time about, if I have concerns, how would they be best communicated? Because obviously I don't want to make you feel bad or defensive, but I want to just let you know from the outside, this seems like a not very good choice. And then next bullet, please. And then remember that it's not your recovery. And this actually is probably one of the hardest, I think, is that you don't have control over this recovery. That consumer, it's their recovery. So you can support, and you can, you know, support in many ways, like we talked about in earlier slides. But when it comes right down to it, you don't have control over it. It's not your recovery. And sometimes that's hard to remember, but it's really important to remember, again, because we're going back to empowering them to be their own person, to be independent, to be autonomous. Next slide, please. And then finally, for consumers, first bullet, consider that we all have the same goal and that the intent is genuine, even if it is not exercised the right way every time. And what I mean by that is family, providers, we're all trying to do what's best. And sometimes, you know, for family members, especially when you're close to people, sometimes you say something that came out a little different or came out a little harsh, or not as you would have said it if you would have rehearsed it. But again, we all have the same goal. We all want the consumer to reach that high level of mental illness recovery so they can live a meaningful life along with their mental illness and not be defined by that illness. But families are going to make mistakes, just like you, the consumer, will make mistakes. And you know, providers will sometimes make mistakes. So, I mean, I think it's important that we realize that everybody is really trying to work towards the same goal. So if it isn't going well, to maybe talk about what isn't going well rather than to just cut them off, so to speak. Next bullet, please. Communicate your wants and needs. So kind of going back on what I just said is just, you know, make sure you're letting people know, I like it when you do this, or this kind of support is very meaningful to me, but this particular piece of support feels overbearing. So just make sure that you're letting people know how it's going and being very respectful with that communication, because again, everybody is trying to reach that same goal and the intent is genuine, but you know, we won't do it perfectly. Next bullet, please. So know that when you're communicating your wants and needs, it's okay to need and accept help. Next bullet. It's okay to change your mind. So if you gave permission for them to, you know, for information to be released to your family and for the provider to talk with your family and those kind of things, and for some reason that isn't going okay, you know, it's okay to change your mind. I would encourage you to communicate with your family and communicate with your provider about what's not going well, but it is okay to change your mind. Next bullet, please. And it's okay to say, no, thank you. Okay, so sometimes people are going to offer help that you're just not interested in for one reason or another, and just know that it's okay to say no, thank you. Next slide, please. So I think we're ready for questions and answers if you have any.
Thank you so much. That was wonderful and lots of great information. And we do have a lot of questions. So one of the overarching questions definitely has to do with the communications of the family with the provider and the provider with the family. So I'm just going to, I know we receive calls here at our NAMI Wisconsin office about this, and the real rules of HIPAA, and the ability to speak to a provider. So I'm going to quote one of our board members who says, "What are your suggestions to help families get included in a treatment plan? So often providers will not communicate with families due to confidentiality, even if sometimes the person has signed a consent form."
Mhm. So in my opinion, if they have the consent or the release of information, they can share that information. So I think it's really getting on board. And I think it really does start with the provider. It starts with the provider communicating with consumers what the advantages are of having family members involved. And again, that family can be, defined as whoever the consumer wants. But just, to really communicate that it's this is a long journey. This isn't we can't give you, this is going to be over in 2 weeks. This is a lifetime journey. And so it's going to be important to have people supporting you along the way and knowing and understanding your journey. And so I really feel like it starts with a provider to be able to talk with patients and really encourage that, and letting them know that it doesn't have to be an all or nothing. It can just be for pieces of it. It could be, changed at any time if they don't want that anymore.
And I would just like to add to that. I know one of the things we always emphasize to family members is, even if they don't share information with you, you can share information with the providers, and that can actually help in the recovery, because you're not define anything to share the information that you have that might be helpful. So it is a two-way conversation, and if it's not flowing one way, it can still flow the other.
Exactly, because HIPAA only prohibits the providers from sharing information. Right. And so it doesn't prohibit family from sharing information, and that collateral information can be very important in knowing what's really going on, and not just in mental health, but just overall. And so I think it's very important for family members to have that piece of information as well. And I would agree, I share that information with families as well, because there are some consumers that just won't give that consent.
Right. And so one of the questions is, how do you engage family involvement when the individual is not supportive of having family?
So again, I think my first step would be to talk about, when initiating care with that patient, to talk about the importance of family support, and the importance of having people that you can lean on, that know your situation. It's very hard for people to fully support and meaningfully support people when they don't even know what the treatment plan is supposed to be, those kind of things. I teach the NAMI family to family class, and it's unbelievable the stories that we hear. And families will say that they don't even know what the actual diagnosis is. And so how can we expect them to help or support? Of course they do a horrible job, and of course they ask a lot of questions and are overbearing, because they don't know, they don't have any tools in their tool belt. So I think it's important that we stress that a lot with the consumer. I guess beyond that, I guess you could give information that they could give to their family members if that's something, if you don't have direct contact with them as a provider, that might be a way to just, if you do want to share some stuff with your family, you don't want us to talk, but you want to share some information, here would be some good websites, or here's some good written information. The other thing is, I think as things come up in that person's care, where you could really see, boy, it'd be helpful to have some family members involved now, I think it'd be another chance to re-invite that conversation about, this is a great example of when it would be really nice to have somebody that could meaningfully support you And that might mean being included on the release of information, at least for some of the stuff, maybe not for everything.
Right. And I even think I identify as a family member, and frequently we find the best time to engage that conversation is not during a crisis.
Right.
And to have that conversation and have something signed so that you can talk to the provider. They can always change their mind, and they frequently do when they're in a crisis. But to have that conversation at a calmer time when everybody's in a better place, because it's really hard to have that conversation when they're not in a great place.
Right.
Here's a great question. What would your suggestion be to balance the family help without being overbearing? As communication and family is a key, but allowing for mental illness recovery without development of dependency on the family.
Okay, I'm gonna have to ask you to just repeat that. I'm gonna get a little closer to my mic. Sorry.
What would your suggestion be to balance the family help without allowing them to be overbearing? In other words, allowing recovery, allowing the balance of the family being involved without them, like you were talking about the transference back to recovery, right? How would you suggest that balancing of communication for the family to be involved but not overbearing?
Right. So I think that could happen a couple different ways. So sometimes when I think family is overbearing, I think it is just kind of how they are. You know, we all know people in our life that sort of just kind of take over. You know, you do something in a group setting and they do all of it, you know, because they wouldn't have it any other way, you know, that kind of thing. So with those kind of individuals, if your family members are those kind of individuals, or you've kind of had a long history of them sort of being overbearing and taking, I think that's where those ground rules come in, and that good communication and, when you do this, I feel this way, and the provider really providing some good information on, for this person to have a meaningful recovery, they need to be autonomous as possible. They need to feel like they're their own person and they're making their own choices and, they're doing their thing. And it helps them create their own identity. Now for families, maybe that it's happening inadvertently and it's just kind of hard to let go, because I think that happens a lot also. It's hard to let go of that control. I think also that is, it can be really touchy, I think. I think if the family member is aware of it, I think that, we could talk about it, but we could also suggest, that might be something that is worthy of seeing an expert in therapy, to talk about, and it's because that behavior is probably driven from their extreme desire for that person to succeed and for that person to reach that maximum recovery. They're not doing it, with negative intentions. It's out of love and, those kind of things. So they need to learn how to let go and kind of get out of that person's way. And sometimes that's hard, especially like for parents and if parents are the family members, those sort of things, that can be very hard. So I really go back to lots of education about what recovery looks like, or, what those essential tasks of recovery are. And then also just really good communication between everybody about what's going well, what's not going well. And, sometimes the provider, depending on the setting, is not going to have the time or the ability to do that. So then what are the other resources? Is there some family therapy that could happen, or even individual therapy?
And this, I'm going to kind of combine a couple of questions. There's the question of A, what if consumers don't have family, or B, which we receive a lot of calls for, which is when the consumer has totally rejected the family and is estranged or no longer communicating with them at all. Mm-hmm. How do families navigate that, in your opinion? You just have to let it play out, or what is the best tools for that?
Well, I think a couple of different things, because it could also happen the other way, where the family kind of cuts off the person, the right. consumer. So I think depending on what the situation is, it's going to kind of depend. So I think, again, they could engage in some therapy or use the support people that they do have to kind of help them make amends if it's something that maybe they have done in the past, to, hurt that relationship. But I think it's sort of just a matter of, does that, it's going to come down to, does the consumer want that relationship or not? And if they don't want that relationship, then it probably isn't going to work. I mean, it probably isn't, and not that they might not change their mind when they get to a different place in their life or their illness, it's just going to kind of depend what the dynamics were. But I think some of those things too could be worked out in therapy. I think that it doesn't have to be someone's family, like blood relatives. I mean, I think, we do see a fair amount of people that have nobody. Their family has, been estranged for quite some time. And they don't really have any friends. They don't work, so they don't have any work community. And so I think it's important for everybody, anybody involved, to help them build that community, whether that be in church or in support groups or even like a peer, center where people hang out or whatever. But I think it's important that they find somebody.
And I have a couple more questions. And I'm going to toot our horn with NAMI, the family to family course, the family support group course. How can we get, there's so many times people show up at our classes and they've never heard of NAMI's support groups or NAMI family to family. And how can we get more information into the providers' hands so that they would reference families there and consumers for our peer-to-peer classes and our peer support groups? One of our affiliates leaders has asked that they've really tried to get that information out and they're having a hard time getting it. So you're a teacher as well as a provider. So what would your suggestion be?
Well, I think it's just a matter of getting the word out, whether it's to providers or whether it's to, Joe Smith on the street. I think that so many of us are affected by mental illness now, either ourselves or a family member or a close friend or a coworker. And I think with COVID, a lot of people are struggling, especially, now. And so I think people's tentacles, so to speak, are up, looking for information, looking for resources. And honestly, I think you're right, NAMI, people don't really know about NAMI. But once you do know about it, you do kind of see it. You just didn't know you were seeing it, so to speak. So I think, to me, I think it's just really getting the word out to whoever, and just, making sure that people realize that they know that this great resource is available.
Well, thank you so much, Dr. Schmidtknecht. And I'm going to leave this with one question. It wasn't really a question. This one person said, anonymous said, recovery means empowerment. That's it in the nutshell. And so I'm just going to leave that there because that's exactly what it is learning empowerment. So thank you so much for joining us today and sharing all your information with us. We really appreciate it.
Thank you for having me.
Absolutely. We will now be going to drawing a name for the final winner of our raffle basket. So Ellie, can you pull that up for me? And the winner is, I think it's Teresa T. All right, Teresa, you get our last basket and we will be in contact with you soon and figure out the best way to get that raffle basket to you. I'd like to end by saying, please take a moment to answer a few short evaluation questions that will pop up at the end of this webinar. Also, please take a moment to view our video of our 2020 IRIS Award winners. These are award winners given by our NAMI Wisconsin Board of Directors. These awards are given to people who stand out in their efforts, contribution, and dedication to improve the quality of life of people affected by mental illness. Congratulations to our IRIS Award winners. We're so proud of you and so grateful to have you in our organization. Thank you also for joining us for all of our presentations. They will be available on our website soon, and you will be able to watch them again as well as the PowerPoints. Join us on Facebook, Twitter accounts, to keep informed on our other upcoming events. And please share NAMI's name with everyone you know. Thank you so much and have a wonderful day.